Good afternoon and welcome again to The Doctor is In. I'm Jim Callow. The Doctor is In brought to you by Bay Area Medical Center. And Craig Mansur has been serving our community as the chaplain at BAMC for the past 18 years. And in his previous training and during his time at BAMC, he's gained knowledge and insight into end-of-life planning needs in general and has become an expert on the 5 Wishes program. And that's what we're going to talk about this afternoon. Welcome to our show, Craig.
Thanks, it's good to be here.
All right, well, let's first of all talk about just what the 5 Wishes program is. And I guess it's sponsored by the hospital and the Bay Area Medical Center Foundation, right?
Yeah, that's right. It's 5 Wishes is Advance Directives. The hospital for inpatients offers the bare bones state of Wisconsin form. But the 5 Wishes is a form that's a little more extensive and a little more pliable, helping people come to an understanding and sharing what their wishes are, what their values are, around their medical care and around end-of-life decisions.
So you want to talk a little bit about how the 5 Wishes is similar and different to the Advance Directives that everyone sees?
Yeah, the 5 Wishes is something that covers or is covered by a number of states. Every state has their own laws, and that's what a lot of people don't realize. And Bay Area Medical Center, serving both Michigan and Wisconsin, has a unique problem and opportunity in that with every state having their own laws, we have to figure out with patients from each state, each side of the border, how it is that we can make sure that what their wishes are followed. The Wisconsin laws and the Michigan laws are similar in some ways, but there are some significant differences. The 5 Wishes is recognized by both states, by a number of other states also, but by both states, which is really important for us here. It's also recognized by other states, which is important for those folks who spend a significant amount of time, like folks who go down south for the winter. If they spend a significant amount of time in another state, they should make sure that they have advance directives that will be recognized in the state they spend that much time in.
Do the 5 Wishes work in, say, Florida and Arizona, a couple of more popular places?
Off the top of my head, they work in Florida and Arizona, but they don't work in Texas and Alabama, which is where we have a lot of folks going to all 4 of those states. And so it's really important for people to know where they're going and what is recognized in that state.
Yeah, and even if you're going to one of the states that don't recognize the 5 Wishes program, doing it provides a good basis for following the laws of that state.
It does. Many states will at least try to follow your advance directives, even if that state doesn't recognize the specific form. But the thing that we really encourage and one of the things we're really looking for in providing 5 Wishes is to start the conversation, to get people started to talk to their loved ones about what their wishes are. The 5 Wishes, the state 5 Wishes, have 2 specific areas that they deal in. One is, if you're in the hospital and you can't make decisions for yourself, who can? And that's really important at any time in your life. And you need a legal form to tell those folks in the hospital, whatever hospital it is, who can make your decisions. But the other part of it is that it covers what your wishes are around end of life. And that's one of those areas that families oftentimes avoid talking about, and yet is needed more and more as our medical care advances. We find that people are faced with these dilemmas more and more.
All right, well, the first of the 5 Wishes is who's going to make the decisions for me if I can't make them myself.
Yeah.
And so what are the other 4?
Yeah, the first one says, yes, if I can't make decisions, and that can start tomorrow, who makes decisions for me? But the next one in 5 wishes talks about the kind of medical treatment I want, especially right at the end of life. And in fact, the bare bones forms often you basically say, do you want tubes or not want tubes? Do you want something that's put down your throat and helps you to breathe? Do you want a feeding tube placed? The strength of the 5 wishes form is that it has a definition of what life-sustaining treatment is. And you can use the definition it gives, you can alter that definition, or you can make up your own, which is very important for people who have concerns around that to follow their own beliefs, their own ethics, their own values.
All right, so...
Oh, I'm sorry. So you asked that was 1 and 2. So person who's making decisions for me, medical treatment I want or don't want. The thing about the 5 wishes is it continues on and it asks, so what are the kinds of things that make me comfortable, physically comfortable? And that's wish 3. Wish 4 is how do I want people to treat me? Do I want people present right at the end of my life or not present? You know, who is my faith community? Do I want them notified or not notified? And then wish 5 is what I want my loved ones to know. Something that oftentimes is very touching is it states right there, I want my loved ones to know that I love them. I want my loved ones to know I forgive them. There's different wishes that are made known in those places.
And these are all good things to be thinking about long before the end of life. And as you said, a lot of people don't get around to doing that.
That's right, and it goes all the way down to some of the final decisions, like does someone know my funeral wishes or where I want to be buried? Because there's so many times that someone's been in the hospital for quite a while, and we know where it's going, and after the person has passed away, we come into the room and say, so do you have a funeral home that you'd like us to contact? And there's this look of surprise in their eyes because they just haven't gotten that far. It's really a gift to loved ones if you take the time to make sure that you make these choices so that in those difficult times they don't find themselves overburdened with so many choices to make.
Well, this is The Doctor Is In, and our guest is Craig Mansur, who's the chaplain at BAMC, and the part of his duties is that he runs programs that you can attend, and he'll help you walk through the 5 Wishes program and to get the forms filled out, and
That's right.
And it certainly will make it easier for you. So tell us about just how and when these classes happen.
We offer these programs every 3 or 4 months. Once in the morning, once in the evening. You can certainly just give the hospital a call and talk about or ask about the programs. You can also visit the website, bamc.org. The other possibility is, if you'd like, you can just call the reservation line, which is 715-732-8285, and make a reservation.
All right, when's the next class is going to be?
The next class, I'm sorry. The next class, I believe, is in January the 16th.
Or 17th, I think, according to the brochure. And so I see that there are daytime and then evening times.
Yep, there's one at
available.
10 o'clock each time and one at 6 o'clock to make sure that we have the right times and dates. Just call and make that reservation so that we can make sure we have enough room for everybody.
So you sign up. Who should you bring along?
This is a time when you do want to bring along family and friends. You want to bring along those people who need to know what your wishes are. Now, what we do with the class is we actually work through the 5 wishes form. You don't have to complete it that very day, but we work through it line item by line item. And in the middle of all that, I take some time to talk with the class about what the end-of-life care looks like now. Very few people actually die suddenly. That's everybody's plan, but very few of us actually die suddenly. And so since it does take us longer, we find that we face lots of choices. And it's important for people to start to understand what that looks like so that they can see it when those around them are approaching that end of life and the choices that are made, but also for themselves.
All right. I see it says that the class seating is limited. How many people do you have in a given class?
Our classes have varied from 5 to 25. If it would be needed, we would find room for more, but that's how many we oftentimes have.
Is there any cost?
No cost. It's
No
free.
cost. It's taken care of by the foundation?
That's right. Taken care of by the foundation. We think it's important for the people of this community, but it's also important for us so that we know what their wishes are and that it's clear for us.
All right. So you've worked with people in this area for a long, long time.
18 years now. Yes, it's been a real pleasure.
So I think we're very lucky to have someone with your background and to help us out. And again, if people want to find out more about it, the class schedule and more information is at bamc.org, or you can, as you say, call that reservation line at the hospital, 715-732-8285. And you can certainly contact you if they got questions.
They can certainly just contact the hospital's main number and ask to see the chaplain. I'm the only chaplain there. And of course, I'm out visiting patients a lot, so just leave a message and I'll get back to you as soon as I can.
All right. Got a new chapel at the new place?
Yes, we do. New chapel, but old window. We brought the stained glass window from our old building over, so it's nice to have something familiar there.
I understand that, and it's a little more conveniently located, I believe.
Well, it is placed now between emergency and ICU, and it's on first floor, so it's much more convenient that way. But what we also did, our medical surgical unit is on the third floor. We added a meditation room, so patients and their families have an extra room to go to up on the med surg floor.
Excellent. All right, well, anything else you want to mention?
No, a pleasure to be here.
Okay, glad to have you with us. Craig Mansur, chaplain at BAMC, telling us about the 5 Wishes program and the classes that they have. And it's free. Why not take advantage of it? So thank you for being with us. And that is our Doctor is In program for today, brought to you by Bay Area Medical Center. And join us again next time.
Thank you.